Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. About 70% of the people that come to the Hauser Neck Center have eye symptoms. The most common eye symptoms is what I call visual distortion. They have changes in the vision, they have blurry vision. Some people have oscillopsia where everything seems to be moving. They have Mel-Debarkman syndrome where they have gaze instability, meaning that when you and I look at something, we're seeing the same thing in the right eye and the left eye, and it's very stable. So imagine somebody's looking at something and it's bouncing all over the place. And so they feel very seasick, like they're on a boat, even though they're on dry land. Many people have light sensitivity, like they have to wear glasses. Even in the room, the person will have glasses on. There's young people even that come in and they say they've been diagnosed with glaucoma and nobody knows the reason why. They have flashing lights, they have floaters, they have visual snow. The youngest person I ever saw with visual snow was a 9-year-old who said her migraine headaches and her visual snow basically started when she was in kindergarten. So this is like really, really serious stuff. So I'm going to just do a general overview, and in subsequent videos I want to get into more specifics. So this is just a general overview on cervical oculopathy or cervicooculopathy. Pathy, when you see the word pathy at the end, like cardiomyopathy, right? It's damage to the muscles of the lungs. So pathy typically means diseases of ocular pertains to the eye, and cervical means it's related to the neck. So cervical oculopathy is diseases of the eye that in some part or in total are related to the neck. So structural neck issues can cause visual distortions, glaucoma, macular degeneration. I even think retinal detachments where there's not a trauma before the retinal detachment. Recently, I had a patient from Canada who I was treating, the wife, and then I just, sometimes I'll just get into conversation with significant others that are there, and I said to him, "Hey, Joe," his name's not Joe, but just for discussion's sake, "Hey, Joe, what have you been thinking about lately?" And he's like, "Doc, I'm on my 7th retinal detachment, and it all started with pressure that was placed on the eye when the person was getting LASIK surgery." Because I never went through LASIK surgery, but apparently the pressure on the eye during the surgery can somehow lead to a retinal detachment. So it was just in the one eye. Then I said, just because I love scientific inquiry, so I said, "Would you let me just do some diagnostic tests? There won't be a charge on you, just to try to help." So he did it, and lo and behold, he had jugular vein compression primarily on the side of the retinal detachments. And we'll talk about the pathophysiology in a little part about how jugular vein can cause eye conditions, but it was just interesting that his abnormalities on the testing that we did relate to the one side that was getting the retinal detachment. So there's all these eye conditions, and there's risk factors for these eye conditions. The normal risk factors for eye condition, of course, is age. The older we get, the more likely you are to get eye conditions. Obviously, people have poor nutrition, people who have diabetes, things like that. The patient population that I typically see in the office, honestly, it's younger people. It's people who have very little risk factors for these conditions, but yet they have them. They have blurry vision, double vision, after images, visual snow, and they've seen an ophthalmologist or a neuro-ophthalmologist, and they say that structurally with the eye there's nothing wrong. And I'm agreeing with them. It's not a structural eye issue. It has to do with how the image gets transported to the brain. So that's really the issue. For instance, after Hurricane Ian, so I live in Southwest Florida, Marion and I, my wife and I, got 9 feet of water in our house during the hurricane. And we were there and we had to get airlifted out. So if you ever want to see an interesting video, watch the video that I talk about the hurricane. But after the hurricane, because there was so much salt water, you know, just everywhere, like I said, the ocean was pushed into Fort Myers and on Sanibel Island and everything. Basically, the whole island was underwater. It wasn't even an island anymore. Then what happened was the cable systems underneath the ground, there was a problem with the cable system. So everybody's electronics in their house, in their TV and all that stuff, it was all muffled. So basically, you had to take care of the cable system. Like, there wasn't a problem with our TV. Our TV was fine. It was the electrical impulse from the wires underneath the ground that were all screwed up that had to be replaced. So basically, a person doesn't see till the image that you're looking at gets transported to the retina, and that retinal image gets chemically and electrically transported to various parts of the brain. It's a chemical impulse that turns into an electrical impulse. Then your brain interprets it, and that's when you see. So you don't see till the electrical impulse goes to your brain in the occipital lobes. So you go to an ophthalmologist or an optometrist and they say, nope, the eye is fine. But yet you say, no, I have blurry vision, or everything's moving. You know, I have flashes of light, I have floaters, my eye pressure is high, I have eye pain, I have eye tearing. But they're telling you correctly. They're just saying that when they look at things, it looks normal. But in the office here, we're looking at this section. We're looking at like the pupil size. We're looking at the you know, the optic nerve, and I'll show some images of that. And all that stuff is related to the neck. So cervical oculopathy. Cervical oculopathy is when there's a problem with vision that's related to the neck. So the image ultimately goes onto the fovea or the macula or a certain part of the retina where the highest amount of cones and rods are, so you see really clearly. But you don't realize, like when you're moving, like think about you're moving or you're playing sports, there's obviously some kind of connection with the neck and your eyes, because you have to have gaze stability. When you don't have gaze stability, it just means that the two eyes, how it's interpreted in the brain, it's different. That's when you get oscillopsia, visual snow, and you get dizzy, and you get visual distortion. I'm just saying is where there's problems with your vision, like what you're seeing isn't what everybody else is seeing. So if there's a lack of vision in one part of the visual field or something's blurry, I just like the term visual distortion, like your vision is distorted. So it's distorted not because the TV is a problem or the eyeball's a problem, it's the cable system. That's the main thing with this video, is it's the cable system. So, and then there's very easy tests to see if there's a problem with the cable system, which is your optic nerve. So it's right here, the optic nerve. Now you might say, no, the ophthalmologist looked at my optic nerve. No, they're just looking at it through the eye. They're not looking at the part behind the eye. That's what we look at, is the part behind the eye. So this is a image that we made. It's just called the normal ecosystem of the eye, and it's just showing that light comes into the eye. Like, in other words, your pupils have to be a certain size so you don't get light sensitivity. So light sensitivity occurs when your pupils are too dilated. That's one of the tests that we do, is what is the size of your pupil. So then it goes on to the retina. Now, basically, How much fluid is around your eye nerve, the optic nerve, is determined by how freely the fluid can get out of your eye, and the cerebral spinal fluid can get off of the eye nerve, ultimately into the jugular vein, and drains back to the heart. If the jugular vein is compressed, the cerebral spinal fluid accumulates behind the eye, and it can be worse on one side than the other. So imagine if there's more fluid around your right eye nerve, your optic nerve, than your left, the image will get to your brain at different times, and that of course would give gaze instability, because your brain on the two hemispheres is seeing things that are slightly different. Like right now I'm looking at you, or I'm looking at Izzy, who's helping with this video, and the image that I'm seeing in both eyes is exactly the same. So I have 3D dimension. That's correct. Well, imagine if I'm looking at, we'll just say Izzy. So I'm looking at Izzy, and the image of Izzy on my right eye is getting slower to the brain than the left side. You could see where I could get dizzy, I get visual snow because it's cloudy, because there's so much pressure on the eye nerve, or I have gaze instability. And that's not going to show up on a routine ophthalmology exam or optometrist exam. Now, this just shows that you're supposed to have a good neck curve, and when you have a good neck curve, there's not tension on the jugular vein. The jugular veins are the main drainage of the brain, and the vagus nerve is the main nerve that innervates the inner organs. And both of those, if they're stretched and compressed, see how this is a normal neck curve, but people come to me with this kind of a curve. It's reversed. So the jugular vein is getting stretched and compressed, so the jugular vein can't drain. So that means all the fluid that's trying to get out of the eye, out of the ears, out of the brain, it can't get there, so there's going to be a backflow, because all the things eventually go into the venous system. So when the jugular veins block, that's called increased venous pressure. So that increased venous pressure then goes to the brain. Then even the eye can't drain through the episcleral veins. So then the eye can't drain. So you end up getting what's called a double squish. And I'll talk about the double squish in a minute. But it basically all stems from a neck problem, decreasing the fluid flow out of the eye, out of the brain, and basically you can get almost every eye condition. And then on an MR venogram or a CT venogram, I like CT venograms better. This is what it looks like on a CT venogram or an MR venogram, where there's compression of the jugular vein. So the fluid gets blocked here, so it's going to backlog to increase the pressure in the brain and thus increase the pressure of the eye. And then when you get jugular vein compression, you almost always have head pressure, increased head pressure, you get brain fog. But see how you can get eye pain, you can get visual snow, you can get distorted vision. And the most common disease that people get diagnosed with visual snow is migraine headaches. But migraine headaches, in my opinion, most of them occur because of increased brain pressure. Then the arteries dilate in response to that, and that's what gives the migraine headaches. So the treatment is to correct the neck curve and then stabilize the ligamentous cervical instability with prolotherapy, and that can, in many cases, resolve it. So a person gets jugular vein compression, you have fluid starts pressing on different structures in the brain, and then basically you get what's called a posterior eye squish. So if you research posterior eye squish or flattening of the posterior globe on Google, you'll see that increased intracranial pressure is known to compress the eye from the back. Well, imagine if you compress the eye in the back, that's going to affect vision because your retina's right here. So that's one of the squishes, is the posterior eye squish. And then the cerebral spinal fluid is all right here. It surrounds the posterior eye and the eye nerve. So again, as that fluid accumulates, it puts pressure on the eye nerve, puts pressure on the back of the eye, which again could affect the retina, could affect the macula, could affect the vitreous humor, could affect the optic nerve. People, right, MS, where does MS start? It starts with optic neuritis. So optic neuritis is inflammation of the eye nerve. Well, what's causing the inflammation of the eye nerve? Is it an autoimmune disease? Could be. Could it, though, be structural, right? So almost all cases of multiple sclerosis start with lesions in the neck or around the neck. So why are there lesions in the neck? Well, maybe there's a structural neck issue, such as ligamentous cervical instability or cervical destructure, where there's a breakdown of the neck curve. So see how this is the cerebral spinal fluid. See how it surrounds the eye nerve. Then this is what it looks like. This is how we measure it. It's called ocular ultrasound or eye ultrasound. So we're looking at optic nerve sheath diameter. So the larger the optic nerve sheath diameter, the more fluids around the eye nerve, the more likely it's going to be that it's compressing on the eye nerve. So more likely the electrical impulse of what the person's seeing is going to be compromised because of all that fluid pushing on the eye nerve. And then on MRI, what you see how right here and right here, the eye nerve is squiggly. So you get tortuosity of the eye nerves on MRI. So some of the findings of intracranial hypertension or high brain pressure or evidence of jugular vein compression are there can be flattening of the back of the eye or tortuosity of the eye nerves. And the way we show that there's problems with the brain pressure is we measure the optic nerve sheath diameter. In other words, how big is the eye nerve, and when it's over 6 millimeters or 6.1 millimeters, and we get them over 10. Like imagine there's 4 millimeters or 3 millimeters of fluid, extra fluid pressing on the eye nerve. You can imagine how that's going to affect the eye. This again is something that we drew up, which is called the polluted eye ecosystem. So somebody has dilation of the pupils, so we do in the office here pupilometer, and it's amazing how huge people's pupils are. When the pupils are dilated, the fluid can't get out of the eye. That's going to give high eye pressure inside. So the other squish, remember I said there's the posterior eye squish. The other squish is this, where there's high eye pressure. So you could see you have the high brain pressure with the extra cerebral spinal fluid pushing this way. Then you have the high intraocular pressure or glaucoma. And I'm just telling you, we have 22-year-olds who have eye pressures of 24, 27. Sometimes it's even in the 30s, like it's so high. So it doesn't mean they have to be on medications to constrict the pupils, but what it means is we have to correct why is their pupil dilated, why is the fluid drainage of the eye blocked, why is the eye pressure high, and it's normally cervicooculopathy. It's from a structural problem in the neck because of obstruction of the fluid flow out of the brain. And then this just kind of shows it. You have a normal cervical lordosis, you have normal pupil size, normal eye pressure, fluid can get out of the eye. You have the eye internal jugular vein compression, you have the vagus nerve degenerated because of a breakdown of the neck curve, then the pupils massively dilated, then the fluid can't get out of the eye, it stays in the eye, high eye pressure, inflammatory substances start accumulating in the aqueous and vitreous humor in the eye. Then if the temperature goes high in the eye because of the inflammatory substances, you can get the vitreous humor starts breaking up a little bit or liquefying, and then you get floaters, right? You get all these floaters. Or because there's pressure here and there's pressure here, you could see where somebody might get a retinal detachment, the macula, the part of the macula or the part of the optic nerve can start to get degenerated. You could possibly get retinopathy. You obviously have the lens here, it's in the back here. If there's so much high eye pressure, there's inflammatory substances, obviously you could have a setup for a cataract, right? So even cataracts, and then the dilate, imagine this, if this was your eye, the sunlight's gonna hurt so much, or even these lights, right? Too much light's getting into the back of the eye, so that's what gives photophobia or light sensitivity. And then I just wanted to show this. This just shows that if you look over here, you get compression of the carotid sheath. The vagus nerve and the jugular vein are in the carotid sheath. When you have a breakdown of the neck curve and you get obstruction of the carotid sheath, it can increase brain pressure, and you get double vision, loss of vision, blurry vision, all different kinds of symptoms. And obviously, if the brain pressure is going up and toxic metabolic inflammatory waste products can't get out of the brain, you're going to get, theoretically, you could get mental illness, dissociation, depersonalization, anxiety, depression, and even dementia long term. And then this is just another mechanism, like when you have dilation of the pupil, think about, say somebody's a normal person, they're healthy, then all of a sudden you're in the car and somebody almost hits you. Like, wouldn't your pupils dilate? So I look at pupil dilation or light sensitivity as an imbalance in the nervous system. And when your sympathetic system is in overdrive, it causes vasoconstriction of arteries. So if you get vasoconstriction of the ophthalmic artery or one of the branches of it, you're going to lose vision. So in like with migraines, it's well known you could get amaurosis fugax, or loss of vision for a minute, 2 minutes, this or that. So just know cervicooculopathy also can cause this sympathetic overdrive, which leads to like amaurosis fugax or loss of vision for a minute, 2 minutes. And this just shows all the different things that can occur. Once in a while I'll see somebody with pupillary hippus. I've shown that on videos and other videos where the pupil's going like this. So if you have oscillopsia, Maldebarkman syndrome, or you notice in the mirror that your pupil's going like this, it's likely it's from a neck problem. And that can occur after a whiplash injury or a head trauma. This is a very good slide because it just shows mechanisms by which ligamentous cervical instability affects the eye. So one of the mechanisms we talked about was the cerebral spinal fluid accumulates around the eye nerve, so that of course affects the electrical impulse of the image to the brain. We talked about how high brain pressure can ultimately lead to the squish and increased eye pressure. Then you get all kinds of visual changes. We talked about if the pupils get too large or the nervous system input to the pupils all screwed up, the pupil can just go like this. And then of course you're going to get blurry vision. And then vasospasm of the ophthalmic artery, you can get temporary loss of vision. And the way to resolve all this is primarily to have a lifestyle that's pro-vagus, because you want your vagus nerve to be healthy, because you need a healthy vagus nerve to really be healthy. It's through the vagus nerve that you experience love. So when you hold somebody's hand or you hug somebody and you get that good feeling, that's through the vagus nerve. The vagus nerve slows the body down, so it puts the body in a rest mode, repair mode, regenerated mode. So if you have problems with vision or distorted vision or blurry vision, it's best to have your vagus nerves as healthy as possible. Then structurally, you need to get your neck curve really good, and that involves different things like sleeping in a position where you have your head somewhat back so you're in a position to have a good neck curve. Then when you're working, you try to have your computer system up so you're helping your neck curve while you're working. Then maybe get prism glasses. Then there's different devices that we use that put somebody in a good neck curve. There's Izzy. And then if there's ligamentous cervical instability, then utilizing prolotherapy. So prolotherapy is an injection technique that causes the ligaments to tighten. So once the person's neck curve is good and the ligaments are tight, then the jugular veins open. So some of the testing that we do in the office is, especially when somebody first comes, are the jugular veins compressed or not? Is there fluid around the eye nerve? Are the pupils dilated? What's the eye pressure? And then every 3-4 months, as we follow somebody, we retest it to make sure that the eye parameters, such as the pupils are getting more normal, the eye pressure is getting more normal, the jugular veins are open, the fluid around the eye nerves is resolving, and usually that correlates with the person's vision getting better. So I'm just here to tell you that normally the prognosis is very good if you have a chronic eye problem. Look into whether or not you might have cervical oculopathy and optimize your cervical curve and stabilize it with prolotherapy, with the hope being that all your eye symptoms resolve.